Good morning, my name's Henry Spilberg and I'm an Associate Publisher in the Journals Department of BMJ. And I'm here to talk to you about BMJ as a company and its products with a particular focus on our publications and related activities. And I'm very grateful to Peter and NetworkPharma for the opportunity to speak to you today. BMJ is a values-driven organisation, and over recent years we've developed 5 core values that underpin everything we do, ensuring that our approach remains consistent across all our business activities. We are evidence-based, transparent, proud of our people, patient-centred and customer-focused, independent and unbiased. These values all contribute towards supporting BMJ's ultimate vision of a healthier world. And the company certainly does have a worldwide presence. We have offices in the UK, in the US, India and China, and staff permanently based in a number of other countries. We have an international journals programme, as well as other products, serving thousands of institutions, millions of customers and users based in almost every country across the globe. As well as the core journals business, there's a wide range of other products encompassing clinical decision support with BMJ Best Practice, online learning for doctors with BMJ Learning, and on examination for medical students. Arising from our mission to advance healthcare worldwide is the Practical Approach to Care Kit, or PAC, which is a tool to support frontline healthcare workers in low and middle income countries. Research to Publication is a modular online course for researchers to help them develop research projects and assist them in turning their work into high quality publications. And we have a busy BMJ events team who manage a wide range of events serving customers in the UK and around the world. Our publishing programme is of course led by the flagship journal The BMJ, one of the world's leading general medical journals, and we have a growing programme of other journals across a wide range of medical specialties. There are too many to list, of course, but these include high-impact titles known for the quality of their research, such as Gut, Heart, Thorax, Archives of Disease in Childhood, Annals of the Rheumatic Diseases, British Journal of Sports Medicine, Journal of Neurology, Neurosurgery and Psychiatry, to name just a few. Looking in detail at our flagship journal, The BMJ, for almost 180 years, this has been at the forefront of medical publication, and it remains a leading voice in research, news, comment, and campaigns. The BMJ has always been a pioneering journal. Indeed, it was the first general medical journal to publish online over 20 years ago in 1995, and in 1998, it led the way in open access by freeing up original research content from behind the paywall, making it available to all. Turning back to the specialist journals, there is coverage, as I mentioned, across all major medical specialties, serving the needs of researchers, clinicians, and allied professionals. Our titles are a mix of traditional hybrid, that is subscription-based, but offering an open access option for those who need it, as well as fully open access titles. And we publish many of them in partnership with leading international societies and organisations. You can see there just some of the impressive numbers from across the portfolio. Over 50 million unique users, 126 million page views, over 9,500 institutions served, and 30 million article downloads. Publishing your work in a BMJ journal ensures a wide impact beyond just the traditional research community. Key papers are press released by the BMJ media team, and there is also the opportunity for wide discussion and dissemination online through social media, and we also offer multimedia options, video abstracts, podcasts, as well as blogs. This in turn leads to increased engagement with the content, driving up citations and downloads. All the journals have very competitive peer review times and offer very rapid online first publication. The journal's programme is developing rapidly, and we've had 3 launches so far this year, with 5 new titles lined up for 2019, including 2 leading society titles from our US team. Overall, the size of the portfolio has more than doubled in the last decade. A quick look now at some of our commercially driven activities. Recently, we've started to develop topic pages for key specialties, and these bring together relevant content from a number of different journals all in one place, along with other useful material, such as video and conference listings. These pages can then be used to promote specific activities or to support attendance at a meeting, for example. And you can see that we've already launched 2 in oncology and cardiology, with more specialty areas to follow in the coming months. These also offer digital advertising opportunities as well. Journal Roundtables are live discussion events bringing together leading experts to discuss a specific topic. The discussion is then written up by our in-house staff in collaboration with the participants in the event, of course, as a high-quality paper for submission and ultimately publication in one of our journals, subject, of course, to the usual rigorous peer review and editorial process. The Roundtable events are funded by a sponsor through an unrestricted educational grant and are, of course, entirely editorially led. There is no sponsor influence in the content or in the paper itself, although in the case of a drug therapy discussion, for example, the sponsor will have the opportunity to review the finished manuscript for scientific accuracy before submission. So the event and the paper itself are managed entirely by a BMJ team, and the resulting papers are among the most cited and downloaded in their respective journals. Another important area for us is the rights and licensing business, and we have an in-house team managing valuable contracts for a wide range of activities. Local editions of a number of our key journals are very popular around the world and typically will be sponsored by a company who wishes to bring together relevant papers for a particular market that they're active in. These are papers that have already been published in journals and peer-reviewed, but they're just being combined together into a convenient product. Integrity is assured through adherence to our guidelines and close monitoring by the team. This is a very successful programme and has been running for over 25 years, and we currently have 19 local editions published in 8 different languages. Other areas managed by the rights team include administration of licensing, handling permissions for figures and full articles, and the inclusion of BMJ content in discovery platforms and aggregating services. Hosted content is a recent innovation. This provides a platform for companies to host their own material and expands on the opportunities we already offer through online digital advertising. The content is not peer-reviewed, but it's clearly identified as being promotional. However, it can be linked to from the journal homepage and can therefore be a very important source of driving traffic towards a company's products. And finally, just a quick overview of some other developments at the moment. The BMJ and also the specialty journals have a programme of patient and public partnership, ensuring that patients are involved at all stages of the research process. And we're now rolling out a programme whereby every paper must state whether or not patients are involved in the research. This is something that the BMJ also pioneered and even has patient editors involved in editing material and peer review. BMJ has formed a recent partnership with Kudos to assist authors in promoting their own research through the submission and publication of a lay summary in the Kudos system that can then be widely shared and disseminated, therefore further increasing the impact of the work. ORCID, many of you will be familiar with, has been widely adopted across the medical publishing community. And in fact, BMJ last month took the step of mandating that submitting authors have to have an ORCID identifier. If they don't already, it's very easy to sign up, and it's fully integrated in our manuscript submission system, Scholar One. And finally, a quick plug for one of our newest journals, Bmj Open Science, which reflects the push towards not just opening up access to research, but the entire research and publication process. And Bmj Open Science focuses mostly on preclinical work, but with a fully open peer review process and encouraging the sharing of open data. I hope this has been a helpful overview of BMJ and what we do. If you'd like any further information, please access the websites or contact me for more information. Thank you for your attention.